Ian is gone, recovery has started, and the mental health harm for many hurricane survivors is just beginning.
It was scary as hell. We were all ready to die. We were literally saying goodbye to each other.
Paul Benedetti rode out the storm with his two elderly parents and one of their elderly friends. He says they floated on mattresses as water filled up the house to their necks.
I just want to cry thinking about it. It's scary, very scary. That was one way I never wanted to die, was drowning. And I couldn't do anything to help anybody.
The variability in response to these kinds of events is very vast.
Allison Holman and Dana Rose Garfin both research hurricanes' psychological impacts. They say acute stress disorder is the most common negative mental health response after hurricanes. Think early PTSD, where it is hard for someone to function.
You might experience being startled, anxiety, nightmares, re-experiencing, feeling like the event's happening again. You could experience it with dissociation symptoms, so feeling like you're out of your body and so forth.
That can eventually lead to long-term anxiety or depression or PTSD, even suicide in some cases. A 2020 study found overall suicide rates increased 23% in the months after natural disasters. Hurricane news coverage consumption contributes to mental health damage too.
People who were at the event, who knew people at the event, and to people who were only exposed via the media. And we have found that all of those types of exposures are associated with increased mental health problems over time.
2017, the same thing happened, but this time it's worse. It's twice as bad. Maybe 3 times as bad.
Someone with a mental health diagnosis or a person who's lived through a hurricane are more at risk for negative mental health impacts. Secondary trauma, suffering after witnessing someone else's distress, is also common for first responders to healthcare providers to journalists. For those on the ground now, the experts say they should be letting stressed survivors process that in time, but have compassion and help should someone need that.
We don't want it to broadly force people to be reliving a traumatic event when they're still in that early phase and they may recover or heal over time. At the same time, we want to have resources available to people.
It's really important that people have mental health first aid available to them, especially if it's done in a really compassionate way. It's going to help bring people back from the edge of having too many symptoms, mental health symptoms.